The question is, shall the bill pass? The chair recognizes Representative Forehand.
Mr. Speaker, health care for transgender people and youth is mainstream medical care supported by every major medical association and leading World Health Authority. And if my colleague, Representative Dr. Liston, didn't have time to list out all of the medical organizations that have published statements in support of the kind of care that this bill would prohibit, then I will try to supplement her speech today in that way. The American Medical Association passed on the 12th of June of this year a resolution drafted by the Endocrine Society to protect access to evidence-based gender-affirming care for transgender and gender-diverse youth, noting, quote, "It is the responsibility of the medical community to speak out in support of evidence-based care. Medical decisions should be made by patients, their relatives, and healthcare providers, not politicians." The resolution was co-sponsored by the American Academy of Pediatrics, the American College of Obstetricians and Gynecologists, the American Urological Association, the American Society for Reproductive Medicine, the American College of Physicians, the American Association of Clinical Endocrinology, the Health Professionals Advancing LGBTQ+ Equality, and the American Medical Association's Medical Students Section. I just want to read a couple of the resolutions in that document. Quote, "Resolved that our American Medical Association work with state and specialty societies and other interested organizations to oppose any and all criminal and other legal penalties against patients seeking gender-affirming care and against parents and guardians who support minors seeking and receiving gender-affirming care, including the penalties of loss of custody and the inappropriate characterization of gender-affirming care as child abuse. And be it further resolved that our AMA advocate for protections from violence, criminal or other legal penalties and adverse medical licensing actions and liability, including responsibility for future medical costs for healthcare facilities that provide gender-affirming care, physicians and other healthcare providers who provide gender-affirming care, and patients seeking and receiving gender-affirming care. And be it further resolved that our AMA work with state and specialty societies and other interested organizations to advocate against state and federal legislation that would prohibit or limit gender-affirming care. And be it further resolved that our AMA work with other interested organizations to communicate with the Federation of State Medical Boards about the importance of preserving gender-affirming care despite government intrusions. It continues. And I just want to read again, at least 30 leading professional medical associations have issued public statements in support of care for transgender people and youth, and these include the American Academy of Child and Adolescent Psychiatry, the American Academy of Dermatology, the American Academy of Pediatrics, the American Academy of Physician Assistants, the American Medical Association, the American Nurses Association, the American Association of Clinical Endocrinology, the American Association of Geriatric Psychiatry, the American College of Health Association, the American College of Nurse Midwives, the American College of Obstetricians and Gynecologists, the American College of Physicians, the American Counseling Association, the American Heart Association, the American Medical Student Association, the American Psychiatric Association, the American Society of Plastic Surgeons, the American Society for Reproductive Medicine, the American Urological Association, the Endocrine Society, Federation of Pediatric Organizations, Health Professionals Advancing LGBTQ+ Equality, the Journal of the American Medical Association, National Association of Nurse Practitioners and Women's Health, the Regional Association of Social Workers, the Pediatric Endocrine Society, the Texas Medical Association, the Texas Pediatric Society, U.S. Professional Association for Transgender Health, the World Health Organization, the World Medical Association, the World Professional Association for Transgender Health. Please vote no, Mr. Speaker.